So because I make you guys do those IV videos, this also happened to me. So this is called karma. I lost the video that I originally did for you guys. That's why you guys can't access the link. So I get to redo it today for you guys. And that's because I was so mean and made you do those videos. But I'm just kidding. All right, so we're gonna just go through the steps of the short-term central venous catheter and central line site care, and to give you guys just kind of an idea of what we're looking for. You guys have a printout on D2L of this, but you'll grab your supplies. You'll need a Tegaderm, a site care kit, and you'll need some dirty gloves to be able to, or to non-sterile gloves to be able to take the old thing off. And of course you need hand hygiene. And I'm going to actually take my watch off for this one and roll my sleeves up just to make things better. So of course we identify our patient and tell them what we're doing and all that good stuff. And then we always, upon entering, we hand hygiene. We've cleaned our table and made sure that it's clean to put all of our supplies on with that. And when you're going to open up your package, your site care package like this, and when you open it up, this will be inside there. And I recommend just having the garbage actually right next to your bedside so you have it very, very close so you're not turning your back to the patient. I want to talk to you, so there's a little bit of turning, but just to remember that with your patient. So when you open these up, there's a little tag in there. And when you open that up correctly, this way, on the top will be 2 masks. And so you want to grab those masks out of there. One is for the patient. So I will just set this on top because obviously they have no mouth. And one is for me. And I'm going to keep mine off because I want you to be able to hear me on my video. But we remain masked. We will also, any visitors in the room, we recommend that they remain masked if they're going to be in there too. When you open this up, that's a central line. And Liz will talk to you a lot about those infections that are so important and costly and can be deadly. So big deal. Alright, so we have gotten our masks. So we've opened that up and we've gotten our masks there. And now we're going to remove this old dressing off of here. So we're going to put gloves on. There's a couple ways that people remove this dressing. I'll show you the way I like to do it. If you don't like it, that's all right. You can take my opinion or leave it. But I'll kind of start by getting each edge, and then I'll do what we call a stretch method. Oops, there goes the mask. I'll get one kind of corner of each side. Now I want you to understand that these mannequins, it's harder than on real patients because they don't have the skin oils and that type of thing. But if you get a hold of these and you stretch it out like this, it actually just pops, kind of pops right off. Now, I want you to understand that when this is open now, obviously I'd be masked, but we make sure we don't want to touch anywhere in this, not having your patient move around or anything like that. But you don't hold the catheter in place to pull it off in real life. In here, this one came off fine. It can happen on the mannequins because they're more slippery, but in real life, we would never want to touch anywhere near that insertion site. So I've removed my dirty dressing. I get rid of my gloves, and then of course I hand hygiene. And I do my site assessment. I check for redness, drainage, swelling, and Liz will go over the measurement of these types of things. I'll explain that, or she'll explain that to you in lab. So I'm not going to worry about that right now. The next thing is we're going to open up our kit. And of course, we're only touching that outer inch there. We're going to take out our sterile gloves. I'm going to drop the Tegaderm in your sterile field. Now this is kind of tricky, I'm not going to lie. If we open this and dropping it in the sterile field tends to be really hard when you're shaking like this. So you might want to practice that just for the record, just in case this would be a test out. So I usually generally open it like this, and then I drop it in there. Because obviously if that would touch that outer inch, then that would no longer be sterile. Throw that in the garbage. I'm running out of room here. I apologize. You don't want to do that during the test out, okay? If this was a test out. Alrighty. So we're going to open those gloves. And I want you to know, you guys get really upset about these gloves, but these are the gloves that we actually see in the hospital. So we're going to open those gloves. Only touching that outer inch. Now, if I were you, this patient would be on the bedside or on the bed, and so you would have both of this entire room. I'm obviously crossing this sterile field over here, which would never be good, and I think I even touched it in there. So just a no. This is just for demonstration, but just know that that's never good. And I think all of us know how to put sterile gloves on, so we grab the inner cuff of the right glove. And maybe had the thumb. There we go. All right, and then I could adjust that one later. And I grab the inner cuff of this my second glove. Do that C method. Pull that back. That second one on. And now I can adjust as I need with this one. All right, so I've got my sterile gloves on. And the next thing that I do is I'm going to grab this Tegaderm. I snap it or crack it, which basically opens it, and then I start in the middle at the site, and I go, some people do circles like this, but the main thing is you want to go from inside to out. I don't want to clean all the way out here and then go back in and scrub in there, okay? So we start inside and move out while cleaning this. Then this is now going to go in the sharps container, actually. And then now we have our Tegaderm. And there's a little slit on the bottom of your Tegaderm that's going to go, that allows the tube to be out on the end. But you want to place this where the insertion site of this catheter is about in the middle of where your Tegaderm goes. So we go about right there. Place that down. And then there's these nice little tabs here for us to be able to take our Tegaderm off. There we go. And obviously now we're not sterile. So at this point, we can find the one with the little letters on there. We can take off our gloves. Oops, I broke my glove. Glove to glove, skin to skin. Throw all that away. Of course, hand hygiene. And then there's a little sticker on the label that you can put the date, time, and initial of what you did, and then it comes right off of here. Place it on there, and then you can go ahead and go document all your findings. I think that's everything, hopefully. You can all tell me what I did wrong. Okay.